Get used to it before a new law passes. Your son's teenage friends call you the safety nerd. Your significant other rolls his or her eyes when you say, "I can't believe they're still using the term accident." Your mother doesn't know how to describe what you're doing. You might find you enjoy it. It usually doesn't get you promoted and definitely doesn't get you tenure. And well-behaved advocates rarely make history. But taking the risks of being an advocate can also result in rewards. It's the reward of knowing that you've contributed to a positive change in your community, the nation, or the world. It's the reward of knowing that you've left something better than you found it. And it's the reward of knowing that you have taken the founding principles of public health and successfully advocated for an intervention or a policy that has at its core social justice. I've described why we need to be advocates for public health and how we might advocate, but I'd like to give you some specific challenges and some concrete actions and urge you to take them on. For the advocates in the room, I challenge you to organize your community and to work with new partners to make the change that you want to see. For the researchers, I challenge you to work with the advocates to learn how to translate your data and speak their language, so it can be joined with the local stories to put a face on the data, and it can be translated so it can be used to influence policy and inform practice, because a legislator doesn't care about a p-value or a confidence interval, and they're not going to understand a really complex graph. Pie charts and bar graphs are about it. So think about it. For the practitioners, I challenge you to work with your researchers and advocates to discuss with them what you need to improve your practice and to inform what you do. For the students here, I challenge you to stay engaged in APHA and to become active in the sections, SPIGs, caucuses, and affiliates, and to stay in public health and grow your career. To the teachers and faculty, I challenge you to find opportunities to teach your students to be advocates through your leadership and example, and to reward your students for being advocates. To the deans, I challenge you to see the value in having faculty who can teach students how to be advocates, to encourage faculty to have a focus on practice, and to forge linkages between research and practice. And to the funders, I challenge you to find ways to fund policy analyses and evaluations, as well as advocacy strategies. To all of you, I challenge you not only to be engaged in APHA at a national level, but to join and become engaged with your affiliate, to learn and work with the linkages between local and national policy. I challenge you to get involved in APHA and to invite your colleagues to join. And I urge you all to engage in the ultimate public health intervention, which you can take advantage of in another week or so, and that is to vote. And to my fellow Chicagoans, past and present, you know what to do. If we don't exercise our right to vote, we have no right to complain about the outcome. Based on the philosophy of the nursing leader, Virginia Henderson, who defined the function of nursing in a specific way, I'd like to suggest that the unique function of public health is to work with and enable the community in the performance of those activities contributing to its health that it would perform unaided if it possessed the necessary strength, will, or knowledge. And to do this in such a way as to ensure that the community is empowered to become independent in promoting and maintaining the public's health. I thank you all for the honor of serving as your president, and I hope you enjoy the rest of the meeting. Thanks.